So now we're at module 5. And this module is going to be a short one, short and sweet, but this will also save you a lot of money and a lot of heartache if you understand where we're coming from and what the research actually says. So, will an MRI determine what is going on? And we see this all the time where people will come into our office and they'll ask us, "Do we need an MRI?" And I'm like, "No, let's go through a conversation first and start understanding." Now, is an MRI needed at times? Absolutely. And we'll go into when we really need to get an MRI and what questions you can ask your doctor to determine if you really want to get an MRI or not. But they're a very expensive selfie, and the research on them is not great. So let's get into it. So, what does the research say? You know, if I always give people examples as if you took 100 people with no pain whatsoever, and you put them on an MRI, 60 to 80% of them are going to show something. And what happens as the older that we get, the more that's going to show. And this is what research after research after research shows. So if you look at like this picture of some of the research shows you the number of people with disc degeneration. 37% of them will have it at 20 years old, 80% at 50 years old, 96% at 80 years old. So the number is going to go up. Why is that? Why does that happen? So I like to say, as we get older, we get wrinkles on our face. It's just what happens when we get older. Like, that's just what happens. Well, the same thing happens to our bones and our structures. They get older and they get like kind of wrinkles on our bones. That's degeneration that's kind of happening within the body. Does it mean that that's where your pain's coming from? No. And this is where there's part of the problem with MRIs. You'll get wear and tear. It's normal as we age, but your pain may not be coming from that. So that's where the imaging, if you look at imaging, you have to be careful, because more than likely something like that was already there to begin with, and that might not be where your pain's coming from. If you look at bulging discs as we get older, 30% with 20-year-olds, 60% with 50-year-olds, and 84% with 80-year-olds. So if you look at all these things, the numbers are going to go up as we get older. So if you just get imaging, you have to be careful, because it may not be where your problem's coming from. So again, if you look at these 3 different areas and you're only looking at the back, but your problem might be coming from the thoracic spine or from the hip, you're only looking at the back. You're not looking at how the body works together. You're also, when we lie down, that's when they're taking the picture of you. You're not even moving or doing anything, and they're taking these pictures of you. So just because you get this picture again doesn't mean that that's where your problem is coming from. So when would an MRI be beneficial? I always ask, like, the questions that you can ask your doctor is this going to change what you're going to do next? So for instance, I'm just going to send you to physical therapy. No, it's not going to change. I just want to see what's going on. I wouldn't do it. That's, $1,500 that you could save and put it towards, physical therapy. If it's, I'm just want, if it's, yes, I'm trying to figure out what surgery we need to do because there's some red flags and we want to see what we're dealing with, then yes, that makes sense. There's some red flags that are going on that are, making you think that there might be a tumor, or that your disc has ruptured. And like, yes, if it's going to change the outcome of how they're going to treat you, then an MRI is going to be worthwhile. But more than likely, you do not need it. Most people don't need it. They can spend their money somewhere else, because if your pain comes and goes and it's not really bad, like, I wouldn't do it unless it's like last resort of them trying to, like, something's not right. Like when physical therapy, we had a patient that is having back pain, and I'm like, this is not lasting. Something else is going on. We normally see people having, better results at this point. Yes, I do think it's worthwhile for you to get to do further investigation to make sure that we're not missing something. Yes, that is when an MRI is definitely going to be needed, but it shouldn't be the first option. It's very expensive. It does not give us a lot of information. It doesn't give me a lot of information. Sometimes I can pretty much tell you what I'm going to find based on our evaluation and what we see. I can say, like, okay, this is what we're noticing, and this is what we're going to work on, because this is where your pain's coming from. And even if we see some of those things and we know exactly what we need to do to help people get out of pain, that may not show up, like your thoracic spine. Nothing in your thoracic spine is going to show up on imaging. It's just going to show you, okay, there's your thoracic spine and there are your joints. It's not going to show you that something's not moving. So again, if it's going to change what they're going to do in your treatment, then yes, an MRI is going to be worthwhile. If there's some red flags that we're noticing, yes, an MRI is going to be worthwhile. But the majority of the time, I would say skip it, use your money towards something else.